What makes frontotemporal dementia difficult to diagnose? Have you ever wondered why frontotemporal dementia can be so tricky to identify? This condition affects the frontal and temporal lobes of the brain, leading to a mix of symptoms that can easily be mistaken for other issues. One reason for the challenge is the varied symptoms associated with frontotemporal dementia. Changes in behavior, personality shifts, and language difficulties can be subtle. In the early stages, these symptoms might be confused with psychiatric disorders like depression or bipolar disorder. Another complication is the overlap of symptoms with other types of dementia. For instance, impulsivity and hallucinations can also appear in Lewy body dementia or Parkinson's disease dementia. This overlap makes it hard for doctors to pinpoint frontotemporal dementia right away. Additionally, there are no specific biomarkers available to confirm a diagnosis of frontotemporal dementia. Unlike some other forms of dementia, which have clear biological indicators, diagnosing frontotemporal dementia relies heavily on clinical evaluation and patient history. Brain imaging techniques, such as magnetic resonance imaging or positron emission tomography scans, can show patterns of brain atrophy typical of this condition. However, these findings may not be definitive, especially in the early stages. The heterogeneity of frontotemporal dementia also adds to the diagnostic difficulty. There are several subtypes, including the behavioral variant and primary progressive aphasia. Each subtype presents differently, which can lead patients to consult various specialists, such as neurologists or speech therapists. This diversity can delay the recognition of frontotemporal dementia as a neurodegenerative disease. Moreover, frontotemporal dementia often starts with behavioral or language changes rather than memory loss. This can lead to misdiagnosis as a primary psychiatric illness, delaying the necessary neurological assessment. Finally, the progression of frontotemporal dementia can vary widely among individuals. Standard cognitive tests that focus on memory may not effectively detect early deficits related to this condition. Therefore, functional assessments and repeated evaluations over time are often needed to clarify the diagnosis. In practice, diagnosing frontotemporal dementia requires a thorough approach. This includes a detailed clinical history, neuropsychological testing focused on executive and language functions, brain imaging, and sometimes genetic testing if familial forms are suspected. Early and accurate diagnosis is crucial for effective care planning and management, even though no cure currently exists. Understanding the unique clinical profile of frontotemporal dementia can help healthcare providers distinguish it from other conditions, ultimately improving diagnostic accuracy and patient support.